I would like to sensitize you about few important aspects about why research is important and what type of research activities you can carry out, especially as a postgraduate. So, short introduction about myself. I'm Dr. Venkatesh Karthikeyan. I did my MD from AIIMS Patna and currently a senior resident in the same institute. I have 24 publications till date and been involved in 23 different research projects, including funded projects from WHO, UNICEF, and World NCD Federation. So let us begin with the textbook definition of what is clinical research. Clinical research is a component of medical and health research which is intended to produce knowledge valuable for understanding the human diseases, preventing and treating illnesses, and promoting health. So we have a fair idea of what is research, but why should you do research? You are postgraduates, you are just in a very early career stage, and you may not be a faculty in future, or you may not be interested in all these publications and research. But why should you do? What is the purpose of doing it? The first and foremost thing is it's the best way you can give back to the society. Let us take the example of COVID. In AIIMS Patna is one of the leading centers in the development of Covaxin. I just saw a publication where Devendra sir has worked in convalescent plasma for COVID treatment, and that is the best way you can give back to the society. Imagine the impact that study made. Imagine the impact of Covaxin trial made in the lives of people, saving millions of people across the globe. So research is a powerful way you can give back to the society. Also, it is a way to contribute to the scientific community as well, so that it adds up to the growing evidence, which helps in making the science better. And it also helps you to interpret things better. Let me give an example. I'm saying that based on a research article I studied, drug A is better for hypertension management. You have read a different article and you are saying that drug B is better for hypertension management. Who is correct? I'm also quoting a research article, you're also quoting a research article. But who is correct? Here comes the importance of having in depth knowledge about research. Just because something is published does not mean that it is true. What is the type of article, where it is published, what is the type of study, what is the sample size, what is the sampling technique which was followed, what could be the possible biases, how well is the methodology. All these things matter to make a clinical decision. So you need to have a lens of a researcher to make better clinical decisions so that you can give better patient care. And of course, the most important thing for us personally is for CV building. You should have this background of research and you should work in certain specific areas for your CV building. It reflects your commitment to the subject and to the specific areas. For example, my area of interest is NCDs and AMR. I also chair the NCD committee of the World Medical Association Junior Doctors Network, and I'm the national convener for AMR for the Indian Medical Association. So I try to do most of my works around NCDs and AMR. As you may be well aware, even though if I have 100 publication, it may not on random topics, it may not matter much. But if I have solid 5 to 10 publications around my area of interest, it clearly means that I have in-depth knowledge about the subject and I'm committed in working in the direction. So in order to build your CV, you need to do research, especially in the areas which is of importance or which is of interest to you. And of course, job prospects. So knowledge about research and having publications is not only desirable, but it is also mandatory for getting jobs, particularly in medical colleges and in bigger organizations. And also for promotion purposes, from assistant to associate to professor, there is a minimum number of publications which is required. See, if you could see in this recent circular by NMC, two publications are required for an assistant professor and two publications are required for an associate professor. But do you think people who are appearing will come with two publications? Definitely not. If you're appearing for a post of assistant professor at institute like AIIMS, at least people have 20 to 25 publications very easily. So that is the level of competition, and the number of publications you have is the single important parameter which people judge you on your research acumen. So having for better job prospects, you need to have in-depth knowledge about research and have publications. So this again, what is the importance of like order of authorship? So earlier they were considering the corresponding authors also for the promotion purposes, but now they are considering only the first three authors. They're considering different article types like the original article, which can include a cross-sectional, cohort, case control, or randomized control trial. They can even consider your systematic review and meta-analysis also under original under for consideration the promotion purposes. But it's a very good thing because the systematic review and meta-analysis does not need Institute Ethics Committee clearance as per circular from ICMR. So, if you're having a team of two, three good people who are enthusiastic, then it will be possible for you to publish articles at the level of PG itself for systematic review and meta-analysis, and also case series is also accepted. So, in which journals to publish? Again, I will towards the end of the session, I will share a few tips about how to find a good journal, but you need to make sure that it is a PubMed index journal. So, though there are a list of indexing agencies which are recognized by NMCs, central institutes like AIIMS give a lot of importance to PubMed index public index journals publication. So, try to publish in journals which are indexed in PubMed or DOAJ or Embase or Scopus or SCI. So, this will be only publications in these journals or in these database index journal will carry value, or else it may not be read by more people, and the level of impact it makes will be less if it is out of these indexing agencies. And also, the NMC circular also quotes that BCMR and BCME is mandatory for your promotions and job prospects. So, in order to have better job prospects, it is very essential to have knowledge about research and also to have good number of publications. So, okay, now you understand. Now, okay, now I understand the importance of publication. But where should I start with? I would say the best way to start with is to do this course of a basic course, ICMR's basic course in biomedical research. It may not be a mandatory course in few institutions like institutes of national importance, but many institutes, I think, which are directly under NMC, are mandated to do this course. So it's a very good way to start with. It will give you a basic orientation about what is research and what are the basics of it. So once you are having a fair idea of what is research, then you may go in depth and learn about different study designs and other aspects. There are a lot of online courses available. So one such useful resource is this YouTube channel, that is Merit India. It's a channel by our Department of Community and Family Medicine by AIIMS Patna. You could see we have more than 300 videos on various aspects like how to conduct a systematic review and meta-analysis, how to validate a tool, how to do analysis, data analysis from basics till advanced. So almost majority of things which is more than enough for your research career is available in this channel. It is free of cost. Please free to access these videos, and again classified based on different topics. The playlists are made. You can see the playlist and gain knowledge about the different research topics. And okay, I have told you where to start with, and you are now a PG, and you may not have enough time. You will be busy with your clinical work. You will be busy with your exam preparation. So, what kind of articles I can publish? If you speak broadly, you can publish case studies, case series, review articles, original article, systematic review and meta-analysis, letter to editor, perspective or viewpoint, and commentary. Out of all this, which is easiest, you can present easily do a case study. I published in my first year MBBS, and case series you can publish. Review article, even without much of support from others, you can easily write a review article. Pick up an area of interest, review the articles, identify a novel research question, and review a few articles and publish it. And then original article is a little challenging and time consuming, and also you need IECs and support from different people. So original article may be difficult, but of course your thesis you can publish. And SRMA, as I said, a systematic review and meta-analysis does not need a ethics clearance. So you can very well publish it if you're having a good team of 2 to 3 people, a minimal team of 2 to 3 people. If you're having, you can publish. And of course, SRMA is the highest level of evidence you can generate. And if you're expert in certain areas, then you may write letter to editor or perspectives or viewpoint. So all this is definitely doable in your PG. At least case studies, case series, review articles, you should definitely consider. And publishing your thesis, that also is as an original article, is also something which we should consider. There are different study designs like cohort, cross-sectional, case control, randomized control trial, all this. But you're not confident where to start with. Yes, it is the same for everyone. So always try to start with cross-sectional study. which is the simplest form of study where you don't need follow-ups or where you don't need some hi-fi data analysis to be done. So try to start with cross-sectional studies if you are planning to start an original article. And once you do a cross-sectional study and publish it, you will understand most of the nuances involved with publication, and you will be able to publish subsequent studies in a easier way. And I cannot tell how important is this aspect of collaborative research. So you should try to collaborate as much as possible. Collaborate with your batchmates, collaborate with your seniors, collaborate with your department faculties, collaborate with other departments faculties, collaborate with other institute people, collaborate with other country people. So by doing collaborative research, you learn a lot of things. At the same time, you also get to publish in good journals, and you tend to get more citations, and more impact can be made by your work if you are doing collaborative research. And definitely it is not at all possible as a single person, as a single researcher to do. If you are a single researcher, what you can do, you can keep publishing case studies, you can keep publishing review articles. But apart from that, if you want to do something much more impactful, if you want to do original articles, then you definitely need to collaborate with other experts. But where do I find such people? That's a big question. Yes, so for that only, I would recommend you, please do create a ResearchGate account. If you want to take away a point from today's session, I would strongly recommend create an account on ResearchGate. Follow the people who are pioneers in your field, who are who are working in specific areas. For example, if infectious diseases is your area of interest, just follow people who are pioneers in infectious diseases across the world and follow their work. ResearchGate is nothing but it's like a Facebook for researchers. So all the published studies people keep adding in ResearchGate, posting in ResearchGate, and by that way you keep updated about your field, as well as you get to collaborate with others in the who are experts in the field. Also, please maintain your account in ResearchGate as well as in Google Scholar. Just not creation is enough. You need to keep updating whenever you publish. So, as I said, what matters the most first is the number of publications. Once you have a good number of publications, then try to work on improving your number of citations. So that can be possible if you are going to publish in good quality journals. Good quality journals will accept your work if your work is of very good quality. So focus on publishing in high impact journal as a next step. By that way, your H index and I10 index will increase. My H index is 2. It means that two of my papers is cited at least 2 times. So there is a saying that this H index should correspond to your professional age. Okay, so I am 2 years post PG. So my H index is 2. It's a indirect marker of how good researcher you are. So usually people, faculties and professors, they have H index of 20, 25, like that. So it may sound very difficult to get the first citation. It took me so much time to get my first citation, though I had my first publication in 2015. So it is time taking. It is a slow and gradual process. You should follow up. You should keep following up, and you should be persistent in your research effort. And over time, it will improve drastically. And I-10 index is nothing but how many of your publications are cited at least 10 times. So these numbers may seem very small, but that's how everyone starts with. So probably many of you may not even have started publishing, and it's okay. It's like there need to be some point from which you should get started, and consider today's session as a point where you're getting started. Try to publish your thesis, or if you are far away from your thesis publication, at least try for case studies or case reports or for review articles. And also, I would urge all of you to please create an account in Orchid. Orchid is a unique number, just like Aadhaar card. It's a unique ID for a researcher. And whenever you're applying for jobs, especially in international forums, they ask your Orchid ID, in which all your papers will be linked to. And again, LinkedIn is another social media platform for professionals where you can follow the people who are working in your areas of interest. By that way, you keep updated about the activities. And also, LinkedIn is a platform where you get a lot of information about grant openings also. What are the grants which are announced? Or that also you get knowledge through LinkedIn. So again, the grants is very important. You may think that it is for some people who are co-researchers, but it is very essential for you to have a basic idea of what a grant is, what are their requirements, who are the people who call for grants, because you should be aware of where the world is ready to fund. So if I'm going to start working in polio now, my prospects may not be great. But if I'm working in NCDs or in AMR, then my prospects is great because people are ready to fund for it. So you should be aware of these research grants so that it will at least cover your research activities cost and cover your publication cost. So many journals they charge of several thousands to few lakhs for publication, and you should be aware of different grants which are available so that you can cover these publication costs. So there may be even APC free journals, article processing free journals, free journals are also there. But you need to keep an eye on it. For that, all these social media platforms will be helpful. Recently, I published in Future Healthcare Journal, though it's having very good impact factor and indexed in PubMed. It didn't charge not even a single rupee. So that kind of opportunities you need to keep an eye on so that you'll be able to save money in publication. Also check your specialties APIs journal or any other specialties journal which are offering for low cost or low APC. You need to keep an eye on. And despite that, if you are forced to pay some 50,000, 60,000, try to write to the editor of the journal, explain that you are just a postgraduate, you are in the learning phase, and you are from a low and middle income country. Try to write them, and majority of times they give concession. And if you are early career professional, they even waive off the total article processing fee. So just have an idea about this. And as I said, you should be aware of what are the areas within medicine which are being funded globally so that you can do your research activities in the direction. And okay, all this may, of course, be overwhelming. As a PG, what do you say? Where can I get some grants from? Yes, there is a initiative by ICMR, which is MDMS Thesis Support Grant. I got this grant when I was a PG. I got a grant of 50,000 rupees. It's a standard 50,000. And now it has been, if I'm not wrong, it is increased to 1 lakh. So if you are in the first year of your post graduation, you're just starting your thesis, then definitely please apply for this grant. It's not only about the money which you're getting, it adds a huge value to your CV that you are winning a grant at such an early stage. Also, you should be aware of the implications of AI in research. AI usage of AI in research does not mean that you are putting something in ChatGPT and you are getting an output. It is not that. It is about how judiciously you are using, how ethically you are using, and what are the different platforms which is available for data analysis. We have good platforms for literature search in which AI is going to play a role. There are good courses available online. Its usage of AI in academic research itself is a science. So, if you're interested, please explore it as well. Okay, I have written a manuscript. Everything is ready, and I need to publish now. Where should I publish? Just go to this website, Jane Journal Author Name Estimator. Type your title, type your abstract. It will give you a list of journals which can potentially accept your publication, which is relevant for your title and your abstract. And also it gives the indexing status of the journal. It gives the likelihood that it is going to be accepted. So from that, you will be able to narrow down few journals and then go to the journal's website, and then you need to do your research before submitting an article to a journal, because nowadays, since research and publication has become a business, there is a lot of predatory journals and clone journals which are coming up. So if you want to know more about predatory and clone journals, you just go to YouTube. There are few good videos by experts of what is predatory and clone journals and how to identify it. It's a 1 hour video. So you should be aware of this so that you don't waste your research efforts. So I found it very, very difficult during initial phases of my medicine. Like in my, though I published my first article, case study, case report in my first year MBBS. My research career was at a stagnant for so many years during my starting from my final year MBBS till beginning of my PG. Then for the whole 3 years of my PG, I have worked in a lot of projects. I have worked in a lot of publications, a lot of papers, but for getting my first publication in PG, it took me the last month before my exam. I was so frustrated, so anxious. I wanted, though I worked in many papers, I was not able to materialize it. It were very overwhelming for me, and it was very time consuming. I was of the mindset that I should have at least few good publications before I enter my SR interview. But unfortunately, the 3 years of my work in PG, just before SR interview, I was able to materialize only one publication, though many publications were in different stages. It is very frustrating. It is very difficult. But once you start publishing few articles, you will get to understand the nuances of it, and subsequent publications will be relatively easier. So I wish you all the best. I encourage you to participate and in these kind of research related online events, and get your research skills upskilled. And please feel free to contact me if you're having any queries.